Come in.
Hi, how are you today?
Good, how are you?
Good. My name's Alyssa. I'm a student nurse at MCC. Can I get your name and date of birth?
Grayson Vermerlin, 5/21/02.
Perfect. Today I'm going to be conducting a health history interview. It should take about 15 to 20 minutes. Is that okay?
Yeah.
Perfect. All right. What is your height?
5 feet 2 inches.
5'2". Perfect. And your weight?
140.
140. And your BMI?
I think it's 23.
Okay, perfect. Is there a different name that you like to be addressed as, or should I just call you Gracie?
Grayson's good. Yeah.
And what brings you in today?
I'm having a lot of anxiety lately.
Anxiety. Yeah.
Okay. It's not fun.
And are there any health concerns that you've noticed that are linked to that? Anything specific physically?
I feel like I might be getting a little bit of palpitations.
That can be very concerning for sure.
Yes. Just want to make sure it's not anything else, which makes the anxiety worse.
Yeah, definitely understand that. So we're going to start out with some general questions, and then we'll kind of focus more on those big concerns more in depth later on.
Sounds good.
Are you up to date on your current immunizations?
I am.
Influenza, pneumonia, and COVID-19?
Yes.
Okay, perfect. Are you allergic to any medications?
No.
Any allergies that you have?
Nope.
Perfect. Are you taking any current medications right now?
Yes. I'm taking Cymbalta.
Okay.
And Wellbutrin.
Any other like herbal supplements, vitamins, anything like that?
Nope.
Have you had any problems with medications in the past?
Not that I'm aware of.
Do you drink alcohol or use any other substances, marijuana, nicotine, any of that?
I have an occasional glass of wine here and there, but not every day, only on special occasions.
Okay, perfect. Have you had any surgical procedures done in the past?
No.
Any falls recently?
No, not that I can recall.
Do you have any family history of heart disease?
I'm not sure.
Okay. How about diabetes?
No.
High blood pressure?
Yes.
Respiratory disease?
No.
Stroke?
No.
And cancer?
Yes.
And who has high blood pressure?
My maternal grandmother and my maternal grandfather.
Okay, and how about the cancer?
I think it was my maternal grandfather as well.
Okay. Now we're going to move on to the respiratory. Do you have any history of breathing problems such as asthma, pneumonia, or any lung surgeries?
No.
Do you have any shortness of breath?
No.
A cough?
No.
Are you having any chest pain? I know you said you were having the heart palpitations.
Yeah. I don't think it's painful, just kind of I feel it and I know it's there.
Yeah. Okay. Any dizziness?
No.
How's your exercise tolerance? Good, fair, or poor?
Probably poor. Not as good as it should be.
Something to work on. Sure. Do you have a history of high blood pressure?
No.
Heart disease?
No.
Heart attack?
Nope.
Any heart surgeries?
Nope.
No.
Thankfully.
Perfect. Have you ever heard of MyPlate?
Yes, sounds familiar.
Okay, so this is kind of what that looks like. You have your fruits, grains, proteins, vegetables, and dairy. If you had to estimate about what your plate looks like, what would you say the percentages are?
Protein, probably 10%. Vegetables, maybe 20. Fruits, or like 30.
Okay.
30, 40, 50, 60. I'd say the grains probably take up the rest.
All right, perfect. And then any dairy in your diet?
An occasional glass of milk.
Okay. Good. Have you noticed any recent weight gain or weight loss?
No.
Any appetite changes? Have you been more hungry, less hungry, hungry at different times?
Less hungry.
Okay. Any dental problems? You notice any bleeding gums,
No.
cavities, broken teeth?
No. Pretty good, thankfully.
Are you satisfied with your current weight?
Yeah, it could be better, but it's okay for now.
And then how much water do you drink per day?
The perfect answer would be 2 liters.
Is that your answer?
No, probably about 1 liter.
Okay. Perfect. Now we're gonna move on to the gastrointestinal tract. You know, how you digest things. Have you had any difficulties eating, like swallowing or chewing problems?
Nope.
Any heartburn?
Nope.
Pain in general when you're swallowing or digesting?
No, I wouldn't say.
Nausea?
Sometimes.
Okay. Vomiting?
Nope.
Indigestion?
No.
Do you know when your last bowel movement was?
Probably about a week ago.
Okay. And is this usual, the frequency?
Yeah, usually they're pretty spaced out.
What's the normal color of your bowel movements?
Usually brown, I'd say between like soft and a little bit of hardness to it.
Okay. Have you had any problems or recent changes in your urinary patterns? How often you're going? Color?
No.
Any current burning, pain, or hesitancy with your urination?
No.
Do you have a history of urinary tract infections or blood in your urine?
No.
Are you having any hair loss?
Not that I've noticed. Do I look bald?
Not currently. Any dry or brittle nails?
No.
Any sore or skin dryness, itching, sores, color changes in your skin?
I haven't say I've noticed any.
Do you use sunscreen when you're outside?
Not usually, no. That's reserved for beach days. I know it's a good idea, but...
Are you currently experiencing any pain?
No.
What are your sleeping habits?
They're not super great. I'm a night owl, so I like to stay up late and wake up late.
Around what time would you say you go to sleep?
Between 1 and 2 a.m.
And how many hours of sleep would you say you get a night?
On average, probably 6.
Are you having any difficulties falling or staying asleep?
Staying asleep.
You wake up frequently through the night?
Yeah.
About how many times would you say?
Maybe about 3 times a night.
Okay. Do you have any specific limitations with mobility? Any issues moving? Do you use a cane or walking device?
Nope. Not yet.
Any history of arthritis?
No.
Any backaches?
Nope.
Swelling in the joints or weakness in your muscles?
Nope.
Do you wear glasses or contacts?
No.
Do you know when your last eye exam was?
Oh gosh. It's probably been about 5 years or more.
Okay. Have you noticed any changes in your vision at all?
No.
Do you have any hearing aids or hearing loss?
No.
Changes in taste or smell recently?
No.
Have you had any numbness, tingling in any parts of the body, hands, feet?
I don't think so.
Any seizures?
No.
Memory changes at all?
No.
Have you had a history of vaginal discharge, any sores or sexually transmitted diseases?
No.
Issues with your periods?
No.
Do you know when your last self-breast exam was?
Probably about a month ago.
And how about your last pap smear?
I think it's been a year.
Are you using contraception? Are you sexually active?
I'm not sexually active. But I will. Grab it before you tap it.
Alrighty. Who is your support system? Do you have a significant other? Any family?
Family and friends.
Anybody specific? Mom, dad, siblings?
Probably mom, and then best friends. Got 3 close ones.
Good. Do you feel safe in your environment?
Yes.
Home. What are some of your most important health goals?
I think to be mentally stable in the sense that, not having those down days, which has been going pretty good recently. So
Good. Are you satisfied in your career right now?
I'd say so, yeah.
Do you have any current stress about anything specific?
Just nursing school in general, but who doesn't?
Any fears?
No, I wouldn't say so.
Any concerns with your family, work, or financial situation?
I wouldn't say so.
What are your usual coping mechanisms for stress? Do you use meditation?
Sometimes.
Exercise?
Yeah. Sometimes reading is usually my go-to, or doing something that's more self-care related.
Same. Do you have a history of depression?
Yes.
Mood swings?
Yeah, I think so.
And do you have a history of anxiety in the past?
Yes.
What is your greatest personal strength?
That's a good question. I would say caring about other people.
Now, you said you have a history of anxiety, and the medications you're on, are they to help with that?
Yeah.
And have you noticed it getting worse just recently? About how long has that been going on that you've noticed it?
I'd say the past couple weeks.
Yeah.
Okay.
Is there any life changes you can think of that brought it on? Anything specific that happened?
Well, I did just start nursing school back up, so I think that's a cause.
Yeah, understandable. Do you have any health beliefs that impact your care at this time? Are you using any alternative therapies or any herbal medications, anything like that?
No.
What is your ethnic cultural background?
I'm Caucasian.
Over what areas of healthcare do you feel like you have control?
Pretty much everything.
Who do you need close by to you when you're feeling down, ill, having those bad days?
I'd say just my family, my friends usually. I don't want to get them, if I'm sick, I don't want to get them sick, but I still want that comfort,
Yeah. Are there any other questions or anything we haven't talked about that you wanted to?
I don't think so.
Okay, perfect. The doctor should be in to visit with you shortly, and then I'm gonna put all these notes into your chart, okay?
Sounds good.